record on my computer. So if you can accept that, that would be great. And all of the participants have been muted so that we can focus on the two of you as candidates. I'm getting a little bit of a weird feedback. Is everybody else hearing that, or is it just me? I can certainly live with it if it's just me. Okay. All right. Thank you for being here. This is our, I would say how many, but I no longer remember, forum that we have held for our general elections. And this is a little unusual to have a race where we can focus solely on that. Usually we have a lot of different contested races that we're bringing forward to the general election, and that is not the case here. Most of our races were either decided during the primary or were uncontested. So here we are. And so it's really nice because we're going to get a chance to actually maybe learn a little bit more about you than we might have and dive a little deeper into some questions for folks who've participated in the past. We keep a pretty tight rein because we try to get a lot of questions because we have this time and this opportunity. Each candidate's going to have 3 minutes for opening remarks, 2 minutes for questions, and then we'll have closing remarks that will be available, at which point both candidates can use that time as they see fit. I'm going to kick it off by handing this over to Heidi Luquette, who is the president of the Tillamook chapter for AAUW. Heidi?
Thank you. So I'll make this really quick so we can get going tonight. I know we have a lot to cover. I just wanted to welcome everyone to this candidates forum. I am Heidi Luquette, and I am the current president for American Association of University Women's Tillamook branch. And we are a membership organization. We are focused on advancing gender equity, predominantly for women and girls. And we do that through research, education, and advocacy. And as part of that advocacy for many, many years, as Lisa alluded, well over 15, we have hosted candidates forums. We feel pretty strongly that it's important that our community is informed and has facts in front of them. We are a nonpartisan association, and so for us, this is really about education and information that can be shared with the community to make informed decisions. So Lisa Phipps is our public policy chair. She is going to moderate, as she said, and has done an excellent job for us. I'm just going to turn it back over to her and hope that we have a really good night tonight learning about our two candidates. So Lisa, take it away.
Thank you. Often we have a little bit better turnout, but here's what is going to happen after this forum. We are recording this, so it will be on both of our local papers websites for access, and we will post it on the AAUW website as well on Facebook, as well as Move Voters, which maybe the two of you have had an opportunity to hear a little bit about. So it'll have a broad audience. We had a little bit of a snafu with marketing, but judging from the kind of variety of folks I see, I think we got it out there. It's just a matter of people being able to get on this evening. So the fact that we can record it makes this a really nice opportunity. For folks who are participating as watchers, observers of this, you can send me a note via chat. You can put questions in the chat, and I will, as time allows, get those out to the candidates. We already have 10 that we received beforehand, so that was great. So I know the word was getting out there. One of the last things I want to do is make sure that we thank our co-sponsors, the Tillamook Headlight Herald and the Tillamook Pioneer. Very happy to have them on board. They've been great supporters of these events over the many years, and have no doubt that we will continue that relationship well into the future. And their participation certainly helps ensure that folks know that this is this is a forum that you can count and trust when we get it going. So thank you for that, Laura and Joe. So I think we'll just jump right into it. I'll go back and forth so that one person isn't always answering first, and try to keep things moving that way. I will have a timer. I will let you know just quietly, verbally, that you have 1 minute left when you are doing your questions, just so you know you're at the halfway point. And then I'll do a 15-second, but I would encourage you to monitor yourselves as well with a timer. It's a little different online than it is when we're in person. I can also do things like this. No, I won't do that to you. If you gentlemen are ready, I think we are ready to go. So I will start with opening remarks, and I'll ask Representative Javity to take the lead on that.
Thank you, Lisa, for hosting this. Thank you, Heidi, as well. And I'm glad to be here. Thanks everyone for coming tonight. It's good to see a lot of you again. And I will introduce myself. My name is Cyrus Javity. I am currently serving as the state representative for House District 32, which is Tillamook County, as you know, as well as Clatsop County and the city of Clatskanie. I was elected in 2022 to my first term, and I am hoping to be reelected here in next month's election. A little bit more about myself. I moved to Tillamook in 2012. Before that, I lived in Clatsop County in Astoria. Graduated from Brigham Young University in 2002 with a degree in accounting. Worked in the financial industry for about a year. That was following the dot-com bust. Decided that I might return to school for graduate work and pursue a degree in dentistry, which I did in 2005. Graduated from dental school in 2008. Lived in San Francisco. Attended school in San Francisco, and after my graduate work was completed there, moved to Astoria and started working at Tyack Dental there on the waterfront. And then in 2012, purchased the private practice of Brett Hestmark here in Tillamook, and who was retiring, and have been there ever since, and continue to practice full time, as well as serving in the legislature. Other public roles I've taken on. I did serve on the Habitat for Humanity's board of directors for about a year back in 2012. I've served as the dental director for the Tillamook County Health Department, and ran for and served on the Tillamook Port of Tillamook's Board of Commissioners. Served as a secretary and treasurer and board of trustee member for the Oregon Dental Association, and then in my role in the legislature, I've served on the Housing and Homelessness Committee, the Behavioral Health and Healthcare Committee, as well as the Economic Development and Small Business Committee, and currently serve on a couple of task forces related to healthcare. I am married. We have 9 children, scattered between here and North Carolina, all attending either college, high school, or elementary school. And I decided to run for state legislature in 2022 to mostly because I love the Oregon
15.
coast, and I wanted to be able to serve them in any capacity that was available, and thought that my voice could be used in the Capitol. So I ran. Thank you.
Thank you very much. Let me unmute you, Mr. Davis. There we go. All right.
Thank you, Lisa. So thank you, Lisa. Thank you, Heidi. Thank you, AAUW. And thanks everyone for coming tonight. Thank you, Representative Javity, for being here tonight as well. Good to see you all. My name is Andy Davis. I am also running for House District 32. I'm a city councilor up in Astoria. I've been a city councilor since also 2022. We ran in that same election for our current offices. I have some previous experience, mostly at the local level. In Clatsop County, I was the budget chair for 4 years. I was also the chair of the countywide comprehensive plan update, which Lisa, you're a familiar face from your time at DLCD. We worked with you a little bit on that comp plan update. I also was on the budget committee and was secretary of that body for the city of Astoria. And so it's been a trajectory for me of getting involved with and trying to be useful in local government. And this running for House 32 is very much an extension of that. I think that I've been interested as both a layperson, and I went to graduate school for public administration in how the government works and want to do my part in trying to make it more effective. I also work for the government in a professional capacity. I'm a research analyst for the Oregon Health Authority. I work on issues around the healthcare workforce. We do a survey for folks who are renewing their license with the state of Oregon or with the boards that represent the state of Oregon, and then report that data to the legislature and to the governor's office so that they can plan how we try to approach our workforce and see if we need to work on education or work on keeping people happy in the job or work on diversity issues, things like that. I'm, as a background, Cyrus talked to us a little bit about his educational background. I went to Wabash College, which is a bit of an oddity. It's a liberal arts school in the Midwest, all men and very conservative. So I was, in a environment that was very educational for me in many different ways. But I was working with people who were sort of across the aisle from me in that capacity. I was a student senator then too. And then I went to graduate school, as I said, for public administration and really wanted to work on policy analysis. So this is sort of a fit for me in my career and what I see doing. I'm pretty happy as a city councilor. This was not an opportunity that I was really looking for. But when Logan Laity moved out of the district, he called me and asked if I'd be interested in trying to run.
15 seconds.
And I thought that this was a decent opportunity to try and put ideas out there that I was thinking about and have a discussion about what would be good for the district and what the state can play in a role for helping us out.
Thank you. All right. Well, let's just jump right into the questions. Let me pull them up here. And again, folks, if you have a burning question, or as we go through the questions that we already have, if something catches your attention in a response, let's see if we can capture that somewhere. Let me get this up here. So, as you can imagine, at the state level, the questions are much broader than what we can ask our county commissioners. Your level of responsibilities far exceeds what happens here at the local level. And so the questions are much more diverse and can be very personal for some people. As folks know who've been to these before, I do my best to create a very calm question out of some questions that are sometimes fraught with a lot of emotion. So do not be offended if I reframe it. The point here is that we want to make sure our questions are answered. So I'm going to start with a softball to get it going. What are your top 3 priorities if elected to support District 32? And I will have, I'm sorry, I should have been referring to you as Counselor Davis. Counselor Davis, you can go first.
Sure. Thank you, Lisa. So my top 3 priorities have to do with housing, healthcare, and education. The first of those is just because I think housing and the cost of housing specifically is really the biggest challenge for us out on the coast. When I moved here in 2015, there were fixer-uppers available for under 100,000 in Astoria still. And now I looked at a fixer-upper early this year for 350, and that's about the bottom of the market. And that's put things out of reach for a lot of people. And so I think both for our workforce and the health of our local economy, but also just as an equity issue, we really need to be addressing housing. And both Representative Javity and I have identified that as a big need. I think we have different approaches, so I hope we have a little more time tonight to talk about that specific issue, but that's my top one. education and healthcare are sort of tied together for me. We have community colleges in both Clatsop and Tillamook counties that provide some vocational education for healthcare. I think that's a key resource for the area. So especially Clatsop Community College went through some kind of rough times, making sure that they emerged from that as a real leader educationally and able to keep supplementing our local workforce in healthcare. And then healthcare itself is a big issue because we have a aging population on the coast. Part of that even falls into the housing issue because people who are in their 20s and 30s sometimes can't afford to stick around here. But our aging population will need more healthcare as they get older.
30 seconds.
And so providing the resources and the educated workforce to take care of our residents is going to be a big challenge for us going forward.
Great. I already violated my own rule and said 30 seconds instead of a minute. I was listening. I've got to quit doing that.
I just knew I had to stop, so that was all right.
Okay, Representative Javity.
Thank you. I agree, and with Councilor Davis, he brought up really three of the big issues: housing, healthcare, education. I'd add to that cost of living just in general right now throughout the district, and honestly throughout Oregon and the country is tough for people. It impacts everything from childcare to groceries and utilities. Housing and homelessness, would be continues to also be an issue, and the associated mental health crisis that we have, as well as a lack of addiction and treatment resources. We really need to continue to focus on housing like we have. It's frustrating because I know in the legislature and with the governors as one of her goals, she's wanted us to build more housing quickly, but there's a lot of red tape in the way. And while we did try to authorize some money and cut some of that red tape, I feel like it mostly benefited the I-5 corridor. And so we've got some more work to do in the rural part of the state, especially up and down Highway 101. We need to look at kind of some of the low-hanging fruit, like reallocating short-term rentals. We need to look at rezoning. We need to look at ways to more easily adjust the urban growth boundary. We need to adjust things like system development charges and different ways to entice both developers to come here and build, as well as make it easier for city officials and county officials to greenlight projects that they want to but can't because of bureaucratic obstacles and money.
15. Are you done?
Yeah.
Okay. Well, since you started on the housing conversation, that can be our next question. Let me get to it, please. All right. Housing continues to be a cornerstone issue, as we've just heard. Many of the proposed solutions end up putting vulnerable populations in harm's way by trying to reduce forest restrictions on development, which is a lot given Oregon's unprecedented years of fire since 2020, or in wetlands or in hazard zones. What is your opinion about solutions that create this situation? And what, if anything, will you do to protect our vulnerable populations? So we'll start with you, Representative Javity.
Sure, thanks. Yeah, it's a great question. And, in the last session, this came up again from Seaside. So one of the big issues is we have a difficult time finding places to build housing, especially affordable housing with the big A, for people who are are below the income thresholds that would have been established by the state and the feds. And so Seaside approached me and said, you know what, we have some sites within Seaside that we could build affordable housing, but we can't because they're in a tsunami zone. And could you help us out? And so when we looked at the maps and we talked with the LCD and different stakeholders, we found that really we were in a unique situation right there in Seaside and other places on the coast like it, in that you have the tsunami zone and you're hemmed in on that side. You have on the other side the forest, as well as a landslide area, which made it difficult to build there. And so and now with FEMA and the buyout and the overlay of that, we made it even more difficult. And so we had people who were already vulnerable, already living in the seaside area, but couldn't find a place that was safe to live or affordable. And some of the feedback was, well, how can we build affordable housing in areas that are, or that put them at risk? And unfortunately, there's no other option. And so, unless we can change tsunamis or landslides, and so we have to be sensitive to what is possible, what isn't possible. And I think for the most part, putting people in warm, safe, clean homes near services that they need is the best we can do. But what we can also do is then make it so that if there is a disaster, say a tsunami or a landslide, that we've clearly marked evacuation routes. We've looked for vertical evacuation solutions so that people can get to high ground quickly, even if it's a structure near affordable housing. And we'll have to continue to look for more of those spaces throughout the district, because it is difficult. You're right. I mean, it's a big problem. We don't have an abundance of just buildable land.
Thank you. Thank you for that. All right. Counselor Davis.
Sure. Thank you, Lisa. So I think it is a good question and a challenging one in the district. We have in Oregon, I think, I was talking about the comprehensive plan process. I think we have some goals, and part of those goal sets are trying to keep urban boundaries contained with urban growth boundaries and other restrictions on where we develop. And I think that forces on us a trade-off between being able to expand horizontally into new land and trying to build densely. And for me, I think the correct solution for us, even in our coastal communities that usually don't have a lot of dense development, is for us to really try to build up or build more densely on land that is already developed. Do infill projects where we're bringing in duplexes and fourplexes so that we build within existing urban growth boundaries, build on existing safe land, so that we can accommodate the people that need housing, but not compromise either the environments that are around us or compromise the safety of individuals in their new housing.
Thank you. Thank you. All right. Next question. Coastal Oregon is set to experience the impacts of climate change more sharply than many other parts of the state, with sea level rise being a prime example. What is your stance of climate impacts to the coast, and how will you support communities' efforts to become more resilient? And we will start with you, Counselor Davis.
Sure. Thanks, Lisa. So I think we're in an unusual position where even though we have an interface with the sea, my understanding, I took an oceanography class a couple of years ago through Clatsop Community College. My understanding is that because the plates coming into the shoreline are essentially pushing the shoreline plate upward, that we're not feeling the effects of sea level rise the same way we would if we were on sort of unmoving plate. So I'm not actually as worried about that particular concern as some others, though if we have an earthquake and that tension releases, we'll be suddenly a lot lower than we are right now. I think what I do worry about are water supplies and about the vulnerability of our timber stands to wildfire. I think we're already struggling for some communities and rural areas within the district to have enough water throughout the dry months of the year for those communities to live off their surface level water supplies.
1 minute.
And that's going to be exacerbated by climate change. We're already seeing a little bit less precipitation every year, it seems like, and I expect that to continue. And with that, the risk of wildfire grows. And so we've got a lot of communities that have very close interface with wildlands. And because we have had a traditionally very wet forest here, we haven't had as many concerns since the middle of last century. And so we've sort of had a lucky run of it, but I think we've got to be very aware of how we're developing and how we harden the dwellings that are right on that wildland interface and keep resources in the communities for fighting wildfire.
Thank you. Representative Javity.
Yeah, I agree with much of what Andy said. And we do have some unique challenges and some unique conditions here up and down the Oregon coast. And in addition to what Andy said, I mean, we do have the fire risk danger. We do have want to protect our water reserves, and we want to protect the fisheries and the forests, as you know, because those natural resources, including the dairy farms, etc., and the flooding as the water levels move in and out and change, and the rain levels change, how that will impact our local economy, the people who live here, how they access those resources. And so I think trying to stay up on the cutting edge of good science, I feel like we lag about 2 years behind the experts, and then the government's about 2 years behind
1 minute.
behind even that. And so I feel like reducing the gap between what we know is working and what's effective with good policy that really takes aim at and targets some of these concerns, so that we are protecting structures, we're protecting fisheries, we're protecting the longevity of the forest, the cleanliness of the water, and doing that in a way that balances well with just the cost of living someplace. And I mean that in the terms of the impact that both conservation and economic activity have on each other, and how to find a way that we can benefit both, and where those Venn diagrams overlap, really focus and concentrate our resources.
Great. Thank you. All right. Well, I've been running these forever, and I'm like, how did people answer these in 1 minute? These are really big questions, but they do. But I'm very glad we have a little bit more time here. So let's move on. So we're going to switch gears a little bit. Affordable childcare. Affordable childcare is a real challenge and affects so many parents. What plans do you have to address this issue, which has significant economic and social consequences? And we'll start with you, Representative Javity.
Yeah, good. It is a big problem. Childcare is expensive. It's based a lot on the requirements that, as a state, we have instituted to make sure that children in daycare and childcare facilities are both safe, but also their needs, their educational and behavioral needs, are being met. And so, on top of hiring somebody who's very qualified, which is very expensive, we also have facility requirements, and it's caused two things. It's made it very difficult to get a certified facility up and running. We've seen a reduction in the number of just in-home options that are available. And so I've introduced or submitted a legislative concept to be introduced as a bill that would look specifically at the 3 to 5 year old range, and create more options by reducing the number of requirements that are necessary for there to either be a facility that provides care or for in-home care of 3 to 5 year olds. And then also looked at ways to incentivize businesses through tax credits or tax deductions to help stand up and staff full-time facilities in the community that will benefit the workers as well as the employers. And that's how I plan to address that. Hopefully we'll see the effects of that sooner than later.
Thank you. All right, Councilor Davis.
Thank you, Lisa. So another good and challenging question for the district. We've been wrestling with this in Astoria, certainly, for the past few years, and it looks like we're in the process of losing one of our child care providers because they had a relatively cheap place to provide service in, and they're going to lose that facility access. And as Representative Javity said, that's a big part of the challenge for these businesses. I think we have approached it as a city, and part of my approach from the state level would be trying to find good ways to do public-private partnership, whether that's trying to subsidize facilities or trying to underwrite people who are making these businesses work. Both things are options for me. I'm a big supporter of Head Start. I was a beneficiary of a preschool program when I was young, when I had two working parents, and so that makes a lot of sense to me for these programs to be provided and to help kids and families out. And I would just finally say that, you know, this is a statewide issue, maybe a nationwide issue even, but it also provides challenges for young people and just making decisions about whether they want to raise a family or not. And I think in the long term, that's a big problem for us to solve so that people can work and raise a family and do that in an affordable way that seems accessible to them.
Thank you. All right. We do have a lot of diverse questions this evening. All right. Well, now we're going to go to the other end of the spectrum. Elder care on the North Coast continues to be a challenge, with 2 facilities in Tillamook County closing down a couple of years ago. What solutions can you offer to ensure that our older community members have access to safe, clean, and secure shelter and services? And we will start with you, Counselor Davis.
Yeah, that's a huge challenge, and I think like with some of the things we said in our opening comments, part of the approach for me is just making sure that we have the amount of workforce and quality of workforce that we need to provide these jobs. Some of that training can be done at the local level, which is a great asset for Tillamook and Clatsop counties. But then making sure that there are places for those folks to live affordably so they can stay in district is a challenge, and we need to you know, bolster the housing supply just for that need. I think beyond that, that the landscape for elder care is in part difficult because it's often a pretty tight profit margin, and it's a very competitive environment. So the state working to try and bolster the resources that are available. Or many of the folks that are clients of elder care facilities are on fixed income, are taking advantage of programs like Medicare, and making sure that those resources from the federal and state level are as strong as they can be, so that those facilities can keep operating in our district where it can be quite expensive to run those businesses.
Thank you. Representative Javity.
Thank you. Yeah, this is a big challenge. It is very expensive to run a senior facility, and a lot of these senior facilities that we've seen close, but even those are still in operation, are funded primarily through public dollars, and that comes through Medicaid reimbursement as well as Medicare. In the last couple of years, we've seen the cost of employing staff like nurses skyrocket to triple and quadruple what it was pre-pandemic, but we didn't see Oregon Health Plan fees keep up with it. And so facilities like the ones that closed in Tillamook had $1 million in reserve and burned through it quickly, paying temporary staffing agencies outrageous fees to have nurses come and staff. And so it just wasn't tenable. What we need to do to fix that is pay 2 things. One, we need to increase reimbursement rates for these facilities and the providers that work there. That can be done by authorizing more money. Secondly, and we passed some legislation last time that I helped sponsor, which was put a cap on what temporary staffing agencies can charge for temporary for nurses in this situation. And that was a tough thing to do, and we debated back and forth whether or not to put price controls into place. But the healthcare market is so tightly regulated, and there's so many different parts and pieces conflicting and changing the dynamics of that I felt like in this situation that we had the free market taking advantage of very tight labor supply, and that was creating some of the challenges. So whatever we can do to ease some of those financial and economic burdens on healthcare facilities to, one, provide high quality healthcare and safe healthcare and comfortable healthcare, as well as just living conditions on the coast, is how we're going to need to tackle and solve this problem.
Thank you. All right. Next, we have Okay. This is for both candidates. We do have some questions which are geared towards one or another, but I think I'll reframe it so that both candidates can answer them as well. But in this case, this is for both of you. Several coastal communities in House District 32 are exploring ways to protect watersheds that serve as a source for their drinking water. Have you explored how you, as our, House District 32 representative, might be able to assist them? And if so, what are your ideas on this issue? So we'll start with Representative Javity.
Sure. I think absolutely. I mean, we all love clean water and we want to protect our clean water sources. And I think it's easy for us on the west coast of Oregon here to take water for granted because especially in the winter months we get so much of it. But again, going back to what I said earlier, balancing economic needs, which timber harvesting on private and public forests, as well as conservation needs and protecting natural resources, means that we need to make sure there's good buffers around our water reserves. We need to give cities and communities like Arch Cape, which I know Commissioner Davis worked hard on, as well as other areas, control over their watersheds and access to the and control over what happens in and around them. And then on the other side of that, good policy on using that water and making sure it's equitably distributed, et cetera. So I think that this is an area where I definitely rely on our conservation experts, environmentalists, as well as state agencies to provide insight into what best practices are as we develop that policy.
Great. Councilor Davis.
Sure, thanks, Lisa. So yeah, I think Representative Javity alluded to what my primary take on this is, which is I'd like to see communities to the greatest extent possible get support from the state. I know there are some funding streams set up from the state. Arch Cape took advantage of one of them to try and acquire your own watershed land. Why that's important is sometimes there are activities in the watershed, which is all the land that rain falls on that leads to your water supply. Things like timber harvesting can affect it, not always, but sometimes because of spraying. Sometimes it's just things like runoff from erosion can put silt in your water supply that needs to be filtered out. So allowing communities to try and purchase their watersheds is something that I'm interested in. I think there are probably 3 communities, at least in Tillamook County, Rockaway Beach and Netarts and Neskowin, that are at some point in the process. So I think I'd be interested in that. And I think maybe one of the places where there might be division between the two of us on like how we would approach housing crisis plays into this for me, and that is, as I said, I'm very interested in trying to create density, and some of the things that Representative Javity has referred to in terms of allowing smaller subdivision of lots in rural areas. I think we already have areas, say along Highway 26, where you can see people getting spring water because their own water supply is not sufficient. And if we allow more rural development where you're depending on surface water, as those supplies get strained in the summer months, it just becomes more difficult for those rural residents to take care of themselves.
Thank you. All right. All right. So this question is divided for each of you. They frame the questions separately, and I think it makes sense. Councilor Davis, what are your views about school vouchers and public education funding?
The last word was funding. Just to make sure. Sure. So I'm a product up from K through 12 anyway. I'm a product of public education, and I very much believe in public education being a foundation for our society, and making sure that we have people that are fully prepared to enter the workforce and our society as members of our civic bodies, but then also prepared to take the next step into post-secondary education, where they can increase their possibilities in life, and I think that is great to have a variety of public and private resources at that post-secondary level. And I think that it's important for there to be options for people to have private education through K through 12. I'm not supportive of taking away any resources from public education to make that happen. I think that at a base that we should be allowing people to go to get a good education in a public school, and that we should make sure that community resources are kept there and stewarded wisely.
Okay. Representative Javity.
Yeah, great question. The right of a parent to educate, educate their children, is needs to remain well protected, whether they choose to use the established public school system, or they want school vouchers to use alternative options, whether it's homeschool or charter schools, etc. And so I think we need as a state to figure out how to fund all of that. I think that we've come close to fully funding our public education system. We still have not, due to other priorities the state has. I think that's been to the detriment of the school system. I think we've got some outside factors too influencing how well funded our school systems our districts will be throughout the district, in lieu of potentially some of the impacts from our changes to the habitat conservation plan. And I think that I think that this problem is solvable, but again, I think it comes down to the state needing to probably deprioritize some other things, some other projects, in order to fully fund and support a parent's right to educate their children however they want. That being said, all of my children have gone through the public school system, so I'm a big fan of it. I definitely don't want to denigrate that. I understand that some parents prefer a different option. And I'm also in favor of fully funding the school lunch program and filling that gap so that students everywhere in Oregon can get fed at school regardless of income. And I think, but the bigger question too, and what I'll end on is this: as important as the funding is, and I think we need to fully fund it, we're not seeing the results we should be seeing from our children on the state testing scores. As we've looked at those, our rural students are still lagging behind the state average, and then they're lagging behind communities like Lake Oswego, where there's, the per capita income is higher. And I think we need to really address why that is and what we can do to fix it other than through funding.
Thank you. That is a issue near and dear to those of us in AAUW, as you heard at the beginning. So, all right, let's see here. The next question is geared towards Representative Javity, but I will ask a follow-up question for Councilor Davis. So, at the Candidates Forum recently held in Pacific City, I wasn't there. You were asked for an explanation of why you missed 230 roll call votes during the 23-24 legislative session. You explained that you had COVID and couldn't be present for the votes. But it was 1/3 of the votes that were missed. As our elected representative, we expect you to be in Salem during session. Why did you miss almost 1/3 of the roll call votes during the 23-24 sessions?
Good question. And like I explained down there, it helps a little context. I think it's absolutely important for the representatives and senators to be there. It's why I committed to not walking out if there was an issue that the Republicans or Democrats wanted to walk out on, and I didn't, because I think not showing up simply for political purposes is not our role. We're there and we can vote no if we disagree, and we can vote yes if we agree. That being said, the way the flow of bills works throughout the session is that we have very little to do at the very beginning because bills are just getting introduced into committee. So we're discussing them. It sometimes takes weeks for those bills to move through. the committee and get approved to go to the floor of the House. And that's where the roll call votes are done. So as we move through the term, the session, right around March, we have our first big deadline, which is any bill that's going to go to the Senate needs to be voted on. And, there were some games that were played. We had the walkout on the Senate side. We had some stalling that happened. And that meant that there was a backlog of bills the first 2 weeks of March before the deadline. And the week before, or the first week of March, my colleague that I sit next to on the healthcare committee got COVID. And by the end of that week, I started to feel sick and had COVID. And so that next week, we had to move almost 600 or 700 bills in the month of March about 500 bills through the House voting system and over to the Senate. And I couldn't go. And they don't allow remote voting. And you can't vote from your office. You have to be on the floor of the House. And it was against the rules for me to be there with COVID. And so I missed. And so if you look at my total time in the Capitol, I think it's important to remember that I was there for 95% of it through committee meetings and time on the floor, but I happened to miss, unfortunately, a week of very important votes when I had COVID, and I paid attention online, but I couldn't do much about being there. So it's not the explanation I love to give. I don't like people thinking that I get sick, but I did, and that's unfortunately my lame excuse.
It's a fine answer. Thank you. And then so for you, Counselor Davis, so just having heard, just the sheer volume of what can happen over the course of a short period of time, how do you prepare yourself to handle that information almost overload and then still be able to make a decision at the end of each opportunity?
Sure. So I think that's a good question, and I think the biggest part of that is knowing what to delegate. There is a fairly long run up for most bills, not all necessarily. So it's not like you need to study all 500 bills the week that they're presented. Hopefully that's never a dynamic that's happening to the folks in the legislature. So they're in legislative days even in the fall previous. They've been having them already, committee hearings, and talking about what's coming up. As Representative Javity mentioned, they're submitting legislative concepts. So there shouldn't be many total surprises. Maybe there's amendments that you have to deal with getting mastery of, but part of that is also delegating to staff, and not only your own staff in your office, but the committee staff that are working with the legislature to make sure that you're well informed and summarizing work that's coming before you. And then finally, you've got members of the public and lobbying groups and things like that that are watching things like Hawks and are going to be contacting your office with concerns about legislation. So listening to folks that are experts in subject matter and trying to filter through that and figure out what's important for you to take forward and represent from your district or from affected parties is just a part of the job to figure out as you go. Lisa, do I have a little bit of time left?
You do. You have 30 seconds.
Sure. So one thing I just want to say is, like, I wrestled with my staff, campaign staff, even today about the missing vote count for Representative Javity, and I think that's a reasonable excuse, quite frankly. Like, I think that being sick is a thing that happens to people, and so I know that people want to be worried about that. That's valid enough. I think that probably both of us will try our best to represent the district and be available for every vote we can.
Thank you, Andy.
Thank you. I'll just editorialize. I try not to do that, but I suspect every day is full of surprises in the legislature. So, okay, let's see. Here we go. Speaking of sick, get control of that. this is for both of you. In a September report on pregnancy criminalization in the year since Roe was overturned, not even including this year, at least 210 people faced criminal charges related to their pregnancies across 12 states. What are each of your reactions to this statistic? And we'll start with you, Counselor Davis.
Well, first, I think that it's shocking and unfortunate that people are facing those consequences for necessary choices in their lives. And I think that we are fortunate at the moment in Oregon that women's reproductive choices are very well protected, and that I hope that we maintain those protections over time going into the future. I think that we also have a opportunity, if not an obligation, to provide services for neighboring states who are not providing protections for those rights. So someone in Idaho who has a complicated pregnancy and chooses to terminate that has an outlet in Oregon. And I'm concerned, this is more probably a federal issue than a state one, but I am concerned about efforts in some states to criminalize folks that try to move across state borders to get those services. I am endorsed by Planned Parenthood of Oregon and feel strongly about this set of rights and obligations for the state to protect them. And yeah, that's my answer.
Thank you. Representative Javity?
Well, I mean, I'm outraged, honestly, that people are getting arrested for their personal reproductive rights and how they're choosing to exercise them. So I think the states went too far in that situation. I think that that shouldn't be happening, and that fortunately, like Andy said, we don't live in a state that arrests women for choosing to have an abortion or at any point in their pregnancy. That being said, I mean, I do think that the states should act on this. I don't think the federal government is likely to do that. I mean, they've had the opportunity for several decades now to codify that, and they've chosen not to, probably for mostly political reasons. And I think that where states have gone too far, they need to go back to the table and fix that, because arresting those women was, I think, like I said, outrageous and unacceptable.
Thank you. So then the person that sent that in had a follow-up question, and this is for you, Representative Javity. In March of this year, you co-sponsored two bills, Senate Bill 1536 and House Bill 4108. Had they passed, abortion would have restricted it would have restricted access to abortion after 16 weeks. Why do you not support a woman's right to make her own healthcare decision?
I mean, okay, so I do generally support the conversation over when and if there should be any restrictions, but I don't support a full ban. And I think women come to face the decision of reproductive right, whether they should have abortion or whether they should have the baby. I think carefully. I think that it's not an easy decision for them to make. I think there's a lot of things that go into factoring why they feel like they want to or need to, in this case, really have an abortion. I think, like Andy alluded to earlier, I mean, even things like family planning, like to have, in this context of what's childcare going to cost, can factor into a woman who's pregnant trying to decide, how am I going to raise this child? And I feel like we need to do a better job as a state of funding both sides of that of this argument, which is, if a woman does want to have her baby, are we really fully funding that so that she feels like there's not structural barriers to her wanting to carrying that baby and raising that child? So, and Oregon is one of the, and to pivot just a little bit, Oregon is one of the few states in the country to allow late-term abortions, which most people don't support. And in fairness, very, very few abortions go to late term. So I don't think it's a huge problem. And so I don't know why restricting at 16 weeks or 18 or 20, whatever we decide, if we decide, and we're not in Oregon ever going to have this conversation anytime soon.
15.
But if we are, I don't see the harm in having the discussion as long as women and healthcare providers are the ones leading that discussion and that debate. I'm certainly not a doctor that provides healthcare, reproductive services, and I'm not a woman that's ever had to have an abortion or a baby. And so I think that that's the best I can do as a policymaker is take my lead from women and healthcare providers who do have the expertise in this situation or who will be directly impacted. So
Thank you. So along those lines, this is for both of you. What is your plan to expand access to the full range of reproductive health care, including abortion access in your district? And I'd like to just tack on, if it is all right, I'd like to also expand that to ensuring that our children are receiving adequate services and coverage as well, since you kind of tied those two together, Representative Javedy. But we'll start with Councilor Davis and then to you, Representative.
Sure. So thank you for the question, Lisa. So I think that should it ever come before the legislature, I would be fully supportive of parental leave just as a statewide support for folks that choose to have children. I think that that's an important policy opportunity, and we're unfortunate in the United States not to have that as a universally provided leave policy. Second, I would say in the district for reproductive care services, I think that we're in a bit of a care desert in that way. And there were some efforts, some folks that were individually trying to get a reproductive services clinic in Astoria about 2 years ago, and I was very supportive of that effort. I would be supportive of individuals or groups in the communities within the district trying to bring that sort of clinic, whether it's Planned Parenthood or some other clinic that provided family planning services, provided sexual health services, provided abortion services in the district, so that those are available to people without having to go to Portland, which is currently the case for at least the latter service. Yeah, that's my answer. Thank you.
I agree, and I think there's a lot more to do. I think we need to, in a state where where it's legal to have an abortion, we need to make sure that it is done safely by providers that feel well supported and that feel safe and protected. I think one of the nice things about House Bill 2002 this last term or this last session were two things. One, I agree that there are sometimes situations where little children have been exposed to the worst abuse ever by people they should trust and love, and now are pregnant, and they need to be able to have an abortion without parents' permission in those situations. And two, the second part of that bill was another part was that healthcare providers that do provide abortions shouldn't be their information shouldn't be public enough that Joe Q Public can go and harass them, show up at their work or their home, and threaten them or otherwise harm them. And so I felt like that was good. And I think we need more policy along those lines that makes sure that those types of things, that abortion and those that support it and provide it can carry that out safely per the best practices available in medicine. And I think we need to spend as much time and effort. And what we don't do, and Andy had some great ideas, but what we don't do in the legislature is when we do talk about funding, and I was co-sponsored a lot of bills where we've talked about funding services important to people who are going to be having children, like childcare and assistance at the hospital and more money for WIC and childcare, et cetera. We really need to fully fund them, and we don't. And I feel like it's a disservice because I feel like if you're a 15-year-old girl or a 16-year-old girl and you've become pregnant, or even if you're in your 20s and you're thinking, how am I going to go to college? How am I going to finish high school? How will I keep working? I want to have this baby, but I can't answer those questions because maybe the father of the child isn't in the picture, maybe my parents aren't supportive. And so they feel like there really is only one opportunity or one choice. And structurally, I think that's a problem and where we failed our youth in those childbearing years. And until we can fully say you have 100% of the support you need to accomplish everything you would have without had you chose to to keep that baby, or if you hadn't gotten pregnant in the first place. I think we're falling short and we can do better, and I think we need to.
Thank you. This is a short question for you, Representative Javity. Could you explain why your seat was vacated early from the Port of Tillamook Bay?
Yeah, absolutely. I was asked to, it was just right as COVID was starting, I was asked to serve on the Oregon Dental Association's Board of Trustees. This was, in light of my role as a dentist, an opportunity to help navigate our way through the wiles of COVID and what we could best do to serve oral health in Oregon. And at the same time, business at the Port of Tillamook was declining, not because of economic reasons necessarily or any structural problems, but just because of COVID. And so I felt like I couldn't really be in both places at the same time, and that I could do a tremendous amount of good lending my voice to the oral healthcare discussion at the state level. And so rather than doing a poor job in both by wearing two hats, I chose to vacate that seat and allow somebody else who felt like they had the time and the opportunity to serve on the port to do that rather than being a drag on their progress. And so vacated the seat to focus on oral health issues at the state level.
Thank you. We have one more question. I'm just going to do one more quick, because we're actually coming up to the hour that I said that this would be. We've asked all the questions in the chat, as well as all of those that have come in advance. And so I'm going to wrap up with, sorry, let me pull it up here. In this divisive political, in this divisive political arena around the nation, how do you plan on reaching across the aisle and creating partnerships and collaborations versus division and enemies? And we will start with you, Representative Javity.
Good. Thank you. I think that's a great question. I think we're all tired of the rhetoric at the national level. I think that it's turned into, I just finished watching a series on Netflix called Mr. McMahon. It's about professional wrestling. And to me, national politics at this point and what we're seeing on TV mimics and reminds me of the nonsense that you see in something as ridiculous as professional wrestling. And I think we can do better at the state level. And I think for the most part, we do play well with each other at the state level. Many of my colleagues are obviously Democratic legislators, and over 65% of the bills that I sponsored were supported by Democrats. I also supported and co-sponsored many of their legislation back and forth. And I think when you look at the overall volume of bills that we've talked about today, for the most part, Republicans and Democrats in Oregon are getting along and voting on many of the same issues. I think well over 90% of legislation gets bipartisan support. And there's really only a handful of bills that kind of go down party lines. And unfortunately, those are always your kind of tentpole issues. And I'll tell you what really drives it on both the Democrat side and Republican side are the party bases. And I think sometimes it's the bases that we go back to in our districts, the ones that are going to vote in primaries that are so highly partisan that they threaten to punish legislators, both Democrats and Republicans, that don't vote the way they wanted them to on partisan issues. And so you'll see kind of both sides going to their dugouts and digging in the trenches when those tentpole issues come up, rather than really having good, honest discussion. And maybe that's just the way a two-party system is bound to work. And so we're just going to see naturally on some massive issues like that, posturing and divisiveness. But I'd say by and large, what we don't see at the state level among the legislature is discord. For the most part, we see cooperation and true blue, honest goodness conversations and debate and discussion about how we can solve those problems. And right now, honestly, the Democrats have the majority, which means they get to dictate the agenda. And I think they've done a good job of making sure that Republicans just have seats at the table. And I think Republicans, to their credit, have done a good job of pointing out the minority issues. And I don't mean minorities with the big M, like some of our underserved populations. Those I feel are well represented by both sides. But I mean, kind of the dissenting view of the other side on whether that tax increase is too much or whether that policy goes too far. And I think that's what you get from a good, healthy two-party system, is you get good debate and compromise.
Thank you. Since that went a little bit over, I'm going to let you have some additional time too, if you need it, Councilor Davis.
Sure, thanks, Lisa.
Yep.
So this is a tough one for me in terms of how to best answer it. I have lots of mixed feelings right now because this election has been a learning experience for me, and my tenure with City Council has been, so we're a nonpartisan body, but we have some differences in how we are registered as far as the people that make up our City Council. And that group has been very cooperative. I have approached it personally in a way to try and be open to all of my family or fellow councilors and the mayor. I take after what I learned growing up playing baseball, and shake everyone's hand before and after the meeting to make sure that they know that I appreciate their sincere commitment to making our city better. And I think that that's an approach and an attitude I would take to Salem as well. I think I'm interested in good governance, not democratic governance. I think that we don't always make the right choices, and sometimes it's necessary to have both parties there at the table to come to a balanced and good solution. Sometimes the solution is more partisan, but not always. I think what's been frustrating and difficult to even come to grips with is it seems like most of the people that approach me on the street are approaching me because they've seen some negative ad or I've gotten a flyer that says something about my record or about me being super partisan or something like that, which I don't feel like is true. I think one of the things that it bothered me enough that I
30 seconds.
brought the quote up beforehand, and I'll just try to read it to you, but saying that I was further left than Biden. And the context is a quote that says, "I felt like the last 4 years," this is when Biden was running for president, "I've really eroded a lot of norms that allow us to exist sort of cooperatively in our society and not feel like we're antagonists with other people in our communities. And I think that those norms, those thoughts about us being on the same team are important. And while I personally might even be sort of further left than Biden, I think he represents something that we're sort of losing, which is a desire to get people in the country to work together, even if they disagree on things. And I miss that."
Thank you for that. Thank you. Okay. Well, we are at the conclusion. You each have 3 minutes to wrap up. You can use that time as you see fit, but it's your last 3 minutes with us. So think about that as you're doing your closing remarks. And we will start with Councilor Davis.
Sure. I don't have any big closing statement here. I just really want to thank AAUW for providing this forum. I think that it's a critical task within our communities to get this sort of information out, and I appreciate the papers that were the co-sponsors. They've done interviews with or allowed us to submit comments to both the papers as well, and I think it's so important for our community's benefit to get the word out about what we believe in and what we think about good governance. So I appreciate that, and thanks to the other folks that are participating tonight and just listening in to the forum. I hope that you go out and talk in your communities about what you've learned and what you think about what the two of us said tonight. Hopefully that spurs more discussion and we can get more people involved in this civic process. And thank you, Representative Javity, for this is our second forum. So thanks for being at both of them and giving your answers so that we can make a good community conversation out of this.
Great. Thank you very much. And now Representative Javity.
Thank you, Andy. Well, I'll take this moment to apologize to Andy then. I'm aware of the shorter version of that quote, but I appreciated the longer version. You know, oftentimes I only get what the campaign team gives me, and that's my failing sometimes for not asking, more questions or more context. And, my experience with you over the last two forums, and I hadn't met you until the last one, is that you are very honest. And I think you are, your views do speak truth to what you said, that you're not very partisan and you do try to look for good compromise. And I'll make sure the team doesn't that corrects that, and I don't want you to be misrepresented there. So I'll make sure that that's passed on, because I respect anybody that wants to jump in and do public service. And sometimes campaign politics go negative when they really don't need to. So we'll get that fixed for you. I appreciate your
Thank you.
you're bringing that up. Thanks for the opportunity again, Lisa and Heidi and the rest of you. I know that campaigning is an important part of the democratic process, and the getting together with constituents and discussing these issues is it's necessary. It's fun. It feels like it's never enough time. 2 minutes to basically give you a headline of what and why and how. It really leaves out almost everything else. And so, but I think it's good to kind of test the waters and see where we are. And hopefully the takeaway message is you've got a good guy there in Councilor Davis. And hopefully you think the same about me, and that really, we just really care about the community and wanting to get good solutions. And by and large, just like all of you, and just like my patients that I see every day and neighbors, we really agree on 99% of what really is important and how it impacts us and what we can do about it. And it's really only during campaigning that we start to, get lost in the weeds on that. So I think whatever the outcome is from this election will be good for our district. I couldn't ask for a better running opponent here, and for opportunities like this to get to answer these sometimes hard questions, sometimes not so hard. So thank you.
Thank you both. And I would love to have this forum picked up at a national level. This is the way the two of you have been respectful of each other, and the kindness and the compassion that you've shown both to the questionnaires and to each other is touching and speaks volumes. And thank you very much for both being here. Thank you again to the Tillamook Pioneer and the Tillamook Headlight Herald for your support. And of course, to AAUW, who continues to champion these opportunities for our communities to learn more about what it is that's important out there. And Heidi, I saw you come on. Would you like to say a parting word? Okay. All right. Well, thank you very much. It sounds like you may be getting reached out by, I saw a chat come in really quick here. The Tillamook Pioneer is covering the election for the Associated Press and is going to send this to them. And I hope everybody learns how to be a better candidate because of the two of you. So thank you very much, and good luck in your race, and may the best person win. And we will hopefully be seeing you all after November 6th.
Thank you. Bye.
Bye.